Hello and welcome. Today I'm going to do a demonstration of GloStream's EMR product, the electronic medical record with the look and feel of the Microsoft platform. We are Microsoft partners and we have embedded Microsoft products into our electronic medical record program. By leveraging this technology, users benefit with intuitive and simple navigation, which I'm going to show you right now. What you're seeing on my screen or on your screen is actually the dashboard. From the dashboard you get to view the entire patient list as well as get the look and feel of Microsoft Outlook, so I could go to my calendar or any of my appointment information, my tasks, or my messages just by a click of a button. From the dashboard you can easily search for patients by their name, for example. So I can type in MI and I find Milton. I could type in JEN and I can find Jennifer. Or I could type in Jennifer's last name, Thompson, or part of Thompson, and find all of my patients that are related with the Thompson action. So I have the ability to search and scroll for patients in many ways. That Thomas was actually finding it by provider. So by date of birth or by social security number or phone number. For example, if I type in 05 dash, I'm going to actually see all of my patients that have a date of birth in the month of May. This helps us find our patients and make sure that we are actually seeing the appropriate patient, as well as by phone number or by social security number if that's how you would like to scroll for your patients as well. So searching is as easy as picking any of the column heads out here and deciding what is the best way to find our patient appropriately today. I also have the ability to search by provider, so if you have multiple providers in your practice, each provider can have their own patients showing up, or you could go out and see the entire office's patients as well. I can also click on Patient Seen On and pull up any patients that have appointments for today. So that actually helps my provider in seeing what patients they need to deal with without having the clutter of the entire database and all the physicians in our practice. You can also see that by highlighting a patient's name, I get their demographic information in a quick, easy to see, customizable demographic screen. I see the patient's name and their date of birth with their age, along with other customizable information. So today I've asked to see the gender and the phone number, email, pharmacies, and primary care physicians, but there's many other items that you can get to see from your demographic dashboard as well. Next to that is the patient's identification cards. That includes their state license or their driver's license. If you put their driver's license in, it'll actually scan their picture and make it an OCR picture in the demographics. Or you always have the ability to use a webcam and get current up-to-date pictures of your patients for better identification, as well as making sure that you're seeing your patients appropriately and reminding you of who those patients are. The insurance card information is obviously good for billing purposes as well as formularies when writing prescriptions. In the status box on the right hand side, you'll notice that this patient, Jim Grayson, has already been checked in for his follow-up appointment. We also have the ability to put in color-coded flags, which are similar to the flags that you might have in your office today that's telling you, is the patient ready to be seen by the next user? So an example would be my check-in staff might say that there's a yellow flag that this patient is checked in, but the green flag says they're not only checked in, but all their paperwork is done, so the medical assistant can now pick up that patient and use that patient to be seen at the moment. So you can color code your flag and your information as much as you would like with whatever color codes and processes that you want to set up internally in your practice. You'll also see that there's the ability to put which exam room and which user has that patient. So I could say that my medical assistant Betty is taking the patient to exam room 13, and it's that easy to know throughout your office where the patient is and in the process and who's seeing them. I have the ability to do many things as simple as the click of a button, and I also have alert messages that I can put out here. So by alerting my patient or alerting my office that this patient is hard of hearing, it allows me to quickly know or to understand that she may have an interpreter with her, or that I need to have behavioral patterns that match this patient's alerts. On the bottom of the screen, you'll see the patient's history, insurance information, medications and prescriptions, as well as any documents that I may need to view about this patient. At this point, I'm going to jump in and show you our document management system so that you can easily see how you can transpose your office from being a paper to an electronic medical record. If I click on things like current immunizations, you can see that I've scanned in my records as they were in the past, or any growth charts that we've had in the past. We also have built-in growth charts, so once you do your vitals on a child, these growth charts are automatically date and documented and actually processed out there appropriately for you with the right dots in the right area. So you, as a practice, have the ability to customize your categories for document management, so it's easy for you to get out here and see everything that you need to see from your paper chart world. So I'm going to close out document management and then get back to my dashboard so that you can actually see from my dashboard other information. If my medical assistant notices that the check-in has said the paperwork is done and that medical assistant is now picking up the patient, they're going to do their portion of the visit with their patient. Usually we start with the vitals, and the vitals are very important because a lot of times the scales or the information for measuring that patient is sitting outside of the exam room. So I might come in here and say that my patient is, we'll say she's 4 foot tall and she weighs about, let's go with 65 pounds. And then I can also come down to blood pressure and say that this patient's blood pressure is 100/60. So it's very simple for me to do my stats on a patient. We'll also say that she weighs, or I'm sorry, her temperature is 101. So we have warnings out there that'll say if you've put stats on a patient that are out of what we call their normals, then you get warnings like that that'll tell you if you've documented something possibly inaccurate. Otherwise, the vitals have been done on this patient as the nurse is taking them and getting them prepared for the doctor's visit. The other part that the nurse or medical assistants do for the physicians is usually their histories. So obviously the physician can view everything with one click button at the bottom to see the history, but I can also enter history by clicking this button up top. A one-click button takes me to where I can add my allergies, my surgeries, social histories, medical conditions, family histories, and all of these have pre-built lists in them to where I could either just touch on them and insert, or I could add on the fly if I wanted to as well. If I'm reviewing my patient's history and nothing has changed since the last time that I've seen them, as the medical assistant, I can click the review button and it'll automatically log that I've reviewed this patient's history so that I have compliant information in my system. The next thing that it's going to do is take me into my medications so I can look at my patient's medication histories. While I'm in here, I'm going to describe a couple of things about the medication module so that you can understand its flexibility and all the great things that the medication module can do for you. The first thing you would notice is these U's next to the all drug option are the formularies, and this is telling me that the formulary is unknown because I have not launched out to my RX Hub to find the formularies that match this patient's insurances. But once you do, the formulary information is apparent and very simple for the providers to help get the patient the right drugs at the right cost. The other thing you'll notice is some drugs out here are in red and some are in black. The red is actually telling us that it is a narcotic, so I may have to print narcotics compared to doing an e-prescribe, and I want to make sure that I'm getting the right prescription out there for my right patients. You'll also notice at the bottom of your screen are other quick win lists that you can build, a practice favorites or provider favorites, as well as the system is automatically keeping up with a provider's frequently used drugs. So if you often prescribe the same drugs, you may see just your frequently used drug list up here and not need to go any further. It's a very quick and handy thing for you to use. The other option that you can see on the right hand side here is the patient's pharmacy name and if it's an e-prescribed pharmacy or not. So if it's an e-prescribed pharmacy, when you are prescribing something, it's as simple as clicking ERX and it will automatically send that prescription out to the electronic pharmacy. Or you can hit send RX and it would know if that needs to go via fax, via print, or if it was electronic medical record or electronic prescribing. I also have the ability to click on this medication history button, and that launches me out to RX Hub, which is the hub that stores all of the pharmacy's prescriptions. And from there, I can actually import all of the patient's medication history right into my file for me, so my nurses don't have to manually enter all that information. It's automatic. The other thing that you're seeing are these other buttons up here, which are all part of your drug utilization review. So it shows you your drug therapies, your drug to food interactions, as well as other medical instructions and other drug interactions. So these can be actually pop-up warnings for you if that's something that you choose to turn on per provider, or you can use them as buttons to highlight when you're prescribing something you're not really familiar with and have the system actually go through and do those drug interaction processes for you automatically. I'm going to go ahead and save and close this information. So now my medical assistant has done my patient vitals, as well as from my patient vitals it's showing me it can automatically diagram for me my my vitals charts, and then of course my history and RX histories have been added. At this point, the nurse can either open the exam for the physician, or depending on your workflow, the physician can now be told via the status that it's his turn to see the patient. Before I jump in and show you the chart note on the patient, I just want to talk a little bit about the rest of the dashboard here and show you that messages are out here, as well as tasks and the appointment information for the provider. So in my messaging, you can see that Christopher Anderson has a lab notification, the Case Williamson has an RX request, and that Andy Bird has a general office message that my provider needs to take care of sometime today. There's also tasks that can be assigned. So in this case, this lab order was not started for the provider, so the provider actually needs to go in there and complete that lab order for that patient that it's attached to. So it's very simple for a provider to know and keep up with everything that he has to do within a day. The other thing is actually creating notes. So I'm going to click on the New Exam button here, and from New Exam, what you're going to see is that it launches me into Microsoft Word. Before it does that, it'll ask me, are you sure you want to start a new exam, or if your nurse started it for you, you can say, no, I need to open the last unfinished exam because I'm not completed with it, or my nurse had started it for me. Today I'm going to say yes and start a brand new exam. From here, it's Microsoft Word driven, and I have my templates or all templates, which shows me all of my other provider templates in my practice as well. I'm going to go ahead and stick with my templates today, and my templates are built under SOAP notes. And so Dr. Earn is an ears, nose, and throat provider. So I'm going to pull up Dr. Earn's template, and then you'll see Microsoft Word. This is inserted as if it's your typical letterhead. So if you have letterhead that you use in your practice today or templates that you use in your practice today, it's as easy as importing this information in through Word, so it is typically Word. And then what you see here are these yellow areas, which are what we call data dictionary items. Data dictionary items, or liquid links, actually pull in the patient's information, like their name, their age, their date of birth, the date of service, their sex, as well as other things like their histories. So now you're seeing her surgical history, her allergies, any medications, or if she had past medical history, you would see that information as well. Because we did vitals on her today, you're actually seeing the vitals the nurse did as well show up right into the note. So all the information that was already provided to you by your nurse is automatically input into your template. I can then do anything from dictate to typing or inserting what we call tags. So on my template area, we have a categories of tags that we can insert as well. So you can insert tags by clicking on them or by voice commanding them. I'm going to talk about a couple of options here. I'm hitting my F5 key, or I could voice command it to go to my next dictation spot. But what I did is I highlighted this dictation point behind chief complaint. And at this point, I have the ability to start dictating my note. So I could say that the patient is going to be presenting with right ear pain. So now I'm holding down my dictation microphone and I will start dictating. The patient presents today with right ear pain, period. She has been taking over-the-counter medications for pain, period. Pain started 3 days ago, and the patient has been having a hard time sleeping and is in obvious pain, period. So you can see that the dictation is actually very easy to put in. I have many options that I can do, from scratching something that maybe had made a mistake, or I can build a scratch program in by hitting one of the buttons on my microphone. So I'm hitting my scratch button on my microphone and it took away my last sentence. I could also have it take away my last word. I can also say underline or bold. So I'm going to say bold obvious pain. And it automatically bolded my obvious pain for me. So I can, by voice commanding anything from adding my tags to voice commanding inside my chart note, is very easy for me to use my system. I can then go from dictation point to dictation point and talk about the examination. The left ear is impacted with earwax. So you can see how easy it is for a provider to be able to pre-build his templates to look and be used just like he does today. So doing documentation via Microsoft Word inside of gloStream's EMR product is really easy for the physicians to maneuver through. I also have the ability to create multiple things, like I can add in pictures or diagrams. So I'm going to go down to my All Templates and maybe borrow a diagram from another one of my providers. So I could have this built in as one of my diagrams, or I can grab another provider's diagram. I think for the moment I'm just going to grab this cyst on the back of the wrist and insert it into my template. At this point, I can double click on it and draw, so I can draw or write or do anything that I want onto this and hit insert, and it moves it into my document, into my chart note exactly. But this patient really isn't here for a cyst on the wrist, so I would rather use one of my tags that I have, which I have an ear tube tag. So I'm going to double click on this ear tubes tag, or I could voice command it. But I'm going to click on that and it'll insert any type of diagram that I want. Again, I can draw or put any information that I want on my diagram. and it becomes part of my chart note for today. So it's very simple to insert drawings or flow sheets or guidelines, any other information that I want. I can actually take a snapshot picture and insert that as well. So the use and friendliness of Microsoft Word as well as our voice commanding process is really a huge win for our providers to be able to get their notes done in a timely manner and be able to complete that information. I can then insert or grab my diagnoses through what we call smart diagnosis or smart treatments, smart orders, or standard diagnosis and CPT coding. Today I'm going to show you how our smart diagnosis options work. By clicking on Smart Diagnosis, I can then say this patient is coming in because of acute otitis media. Because I build my own smart diagnoses, I can say when we see patients that have otitis media, sometimes we do a TIMPAN, and so on this patient I'm going to do a TIMPAN, and I'm also going to remove the impacted ears. I can then say this patient's going to definitely need some amoxicillin, and I'm going to keep her on children's Tylenol for pain. I have patient education that I can check off as well, so I can actually teach them about otitis media as well as set them up for a discussion for possibly adding tubes into the patient. And they can take that education information home with them. I have the ability to do tags, and so a few minutes ago I showed you that I inserted the ear tubes tag, and I could certainly have done that through Smart Diagnosis as well. I'm going to go ahead and check this ear infection tag so that you can see that it can automatically be input into my chart note as well by using Smart Diagnosis. When I click Save and Close here, this is pretty exciting, so pay attention. When I hit Save and Close, what happens is it's going to automatically document my diagnosis and my procedures, which does send it into the billing program, by the way. And it will automatically start to write my prescriptions. It will print my education slips, and it'll insert my tags. So watch. I hit Save and Close, and that was my first patient education sheet, and here's my second patient education sheet. So now I could just hit Print, and that would print off to my default printer or at my checkout office's printer. And then I can save and close it. Once I save and close, it's throwing me into the medication module, and look, it's writing my amoxicillin and my Tylenol children's prescription. I have the ability to set up my own frequency and duration or my own SIGs for any type of prescriptions that I do on a regular basis, which I would probably do so it would save me time. And then all I have to do is hit Send RX and Save and Close, and those prescriptions are written. Once I hit Save and Close, it put me back into my note so that I can finish doing my note, but what you'll see at the bottom is that it inserted via liquid links my diagnosis as well as part of my plan. What am I doing for them today? And then I have a paragraph that was inserted, which is really my dictation. This is something that I tell parents quite frequently. And I obviously have the ability to just cut and paste or take anything out that I don't want into my account just by highlighting and hitting my delete key. So that was an additional tag. It's very easy to do and very friendly on the practice to be able to close off their notes. At this point, my provider would actually probably sign his note, so we can hit provider signature, and it'll put the provider's signature in there as well as saying that it was electronically signed by and the date and time stamp that this was electronically signed. At this point, I hit my Finish button, and I'm sealing my note. I have one last option to go back and change, so I have this what we call Summary of Visit screen that pops up. From here, it's reminding me of the information that I'm sending over to the billing department. It's showing me the prescriptions that I have written. I also have the ability to send a task to my follow-up or a task to my checkout staff saying I need a follow-up in 2 weeks, and I of course would pre-build my own follow-up task, and I have default users or users that I can pick in my practice to send that message to, as well as I can prioritize any type of tasking. At the bottom of the screen, what you're going to see is that I could set up certain letters, and these are my referring doctor letters that go out. I can set up my favorite, or I can have multiple referring doctor letters depending on if I need to send different types of letters to different referring physicians. For example, I might send an endocrine doctor a different cover letter than my primary care physician. So I have the ability to attach that by provider and change the letters. So I have a cover letter that goes out, which is something that I can dictate or pre-build, and I can pre-build most of it and still dictate into it if I would like as well. Or if I like just my standard letter, then the next thing that I'm going to do is offer me to say, add selected notes. And what this means is inside my Word document, I have the ability to attach bookmarks to say, I only want my chief complaint and my assessment and plan to go with this letter, instead of sending my complete note. Sometimes we get letters or electronic medical records that are sent to our office from other programs, and those programs will send you 5 or 6 pages. We don't need that. We really just want to see why they were coming in and what your assessment and plan was. And that information is what goes out with your referring doctor letter. So it makes it much easier on the physicians who refer patients to you. There's obviously other things that we can do, like fax that referring doctor letter. I can fax the referring letters and complete my note in the same step. So that's what I'm going to do, is hit my fax referring letter and complete note. At this point, the system is actually launching out and faxing that referring doctor letter out and completing my note for me. So it's a very simple process for the physicians to make sure that everything that they need to do to make their life better and faster is done, and it's actually completed for us. At this point, I'm going to talk about, just the other pieces to our electronic medical records. So I can look at past exams, I can go into unfinished exams. I also have a calendar, which I really didn't hit on, but I would like to show you a little bit about the calendar. I have the ability to see different providers on my calendar, to preset templates, or to actually see my patients that are scheduled by saying hide my templates and only show me my patients that are scheduled. Scheduling a patient is as simple as double clicking on a spot or actually right clicking and saying to make a new appointment. Once a patient has an appointment out there, I can actually right click on them and mark them as a no-show or a cancel, or I can check them in. Once I check them in, just like the physician had that summary screen, the front desk has a screen that helps them get their prior authorizations, launch out for eligibility verification. They can actually print any templates that they may have, which we have a category for check-in patients, so they can print encounter forms or face sheets or HIPAA forms or any financial forms that are necessary, as well as they get a view of the patient's past billing and any balance details so they can collect money appropriately. So checking in for the front desk is very good and complete as well. The other thing that we can do is actually move appointments. So if Drew called and said, I'm running late, but I do need to come in today, I can actually just drag and drop that appointment to, oh, that patient was already checked in, so I could drag and drop another appointment. Let's see if Aaron is. And I think I just checked him in. Darn it. So let's go find a new patient that we can book out here and show you how easy it is to move an appointment. So I can say what office that patient is coming into and what type of appointment it is. And I can also do recurring appointments very quickly. So if I need to say that a patient needs to be seen on Monday, Wednesdays, and Fridays for the next 3 weeks, I could do that. But really, I'm just going to make this appointment and show you how easy it is to move an appointment from one time slot to another or one physician to another, as well as from one day to another, and it always tracks what's going on with that patient. So that was just a quick preview of how easy it is for your staff to be able to make changes, etc., to your calendar. So that kind of summarizes my account for today, realizing that in a very quick manner we were able to do their vitals and their histories. We were checking them in, we were moving them around our system, we could view their old paper charts, we could also go in and view labs and orders and other things like that as well. But it depends on what kind of patients that you're seeing. And then going into new exams, the customized, easy maneuverability for using Microsoft Word and helping our physicians and providers getting their business done in a timely manner. And don't forget how good our microphones work, having nuance embedded into our program. It's very accurate and customizable by tags or your own voice macro commands to get that information into your system. So thank you, and we look forward to doing business with you again soon.